First of all, your observation is entirely correct. Traditionally, we have not, but again, you've heard me plead for the use of an evidence-based approach, and the evidence-based approach just clearly demonstrates that those social determinants are that important. And I mean, this has been well documented in a vast array, and so we are working very hard. We have had curriculum changes that we reflect that. Just as a specific example, our providers are given extensive training in cultural competency. I mean that, and because without that cultural competency, you can't begin to address those social determinants. So it is something that's continuing to evolve, and I think this is something, it takes a certain amount of time for these practices to sort of wind their way into clinical practice. But I think, again, we are seeing that in the CCOs, in the Medicaid population here in Oregon. There is a board of the patients themselves, a community advisory board, that is in contact with the CCO and makes them aware of the situation. That's but one example, so you do see it sort of easing into practice.
Thank you.